In the meantime, on the Health Beat tonight, some 5 million Americans put up with pain from carpal tunnel syndrome. But there is help, and it doesn't involve surgery. Health Beat reporter Kristen Marino here now to tell us all about it.
Well, it can be really painful with the tingling and heat and numb sensation. Carpal tunnel happens when a nerve in the wrist actually becomes pinched. Surgery is often the only option offered, but there are some alternative options out there you should know about.
It's hard to live life with, and then it gets painful. And then you get tingling sensations. It's very annoying.
Karen Cinnamon is talking about carpal tunnel syndrome, a common injury that made using her hands nearly impossible.
I was dropping things. I couldn't play the piano properly. I had a tough time with the computer.
The same problem almost cost Frank Schrammick his job.
Parts of the job impossible. If you were holding something and you drop it and not even know it was gone.
Frank and Karen aren't alone. Carpal tunnel syndrome affects about 5 million Americans. While surgery is highly successful, Dr. Mark Cohen says there are more conservative options.
We typically begin with a cortisone injection and a nighttime brace that they sleep in. And that leads to significant improvement in a substantial number of patients.
It works for about 1/3 of them. Oral steroids may help relieve pressure, and drugs like aspirin or ibuprofen can also ease the pain. Some studies show laser acupuncture and even yoga may help by reducing pain and improving grip strength. Frank and Karen found relief with a painless laser. It repairs damaged cells and reduces inflammation. They both say it beats surgery.
The surgeons always think they have to cut to make you better. There's always an alternative.
Surgery to me is the last option in anything.
An option she says she can forget about for now.
And listen to this, women are 3 times more likely to have carpal tunnel syndrome than men. The injury is also more common among diabetics. Dr. Cohen says patients often mistake symptoms of arthritis for carpal tunnel syndrome as well. But it's important to know that there are alternative treatments out there besides surgery, even though surgery is often successful.
Important to know.
Yep.
Thanks, Krista.
Thank you. Okay.